Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today I'd like to share my thoughts on working at the COVID-19 clinic. The clinic that I worked at was specifically set up for patients that were either positive for COVID-19 or had symptoms of COVID-19 and needed to see a doctor, either because their symptoms were problematic or because they had other issues going on, like elevated blood pressure, problems with their diabetes, and so on. The first thing that I learned was that I felt very protected and supported by my administration. There was plenty of PPE available for me. I was taught and trained how to use PPE effectively. There was a list with steps of how to put on or don and doff PPE that I followed. I did have to reuse PPE, but I was given guidance on how to do that well, and I felt safe about doing that. The second point that I learned is that wearing PPE is very hot and very uncomfortable. It takes quite some time to put on and take off. And so for my colleagues that are doing this every day in and out in the ICU and in the emergency rooms, I applaud you. It's so difficult to wear that day in and day out, and it's very uncomfortable. The third thing that I learned is that seeing patients in person is ideal. I very much have missed that in this day and age of virtual visits and seeing patients over the telephone and through the computer. It was really nice to be in a room with a patient once again. I realized that I do miss the in-person patient interactions. I think that telemedicine is here to stay, and I think that's great, but I do think there is a need for patient, doctor, in-person visits, and I hope that those will also continue and come back as we continue to move forward with the COVID-19 pandemic. Another thing that I learned is that wearing PPE creates a barrier that's very odd. Even though I was in the room with the patient, seeing them face to face, there was so much in between us with my mask and my gowns, and I was never able to show them my smile or have them see my facial reactions, and I do think that creates a barrier. I know that as we continue to move forward, there will need to be some increased PPE, but I hope that some of that can be eliminated as time goes on. The last thing that I learned is that the current model with the COVID-19 clinics is not sustainable. I wasn't that busy. I didn't see that many patients during that week. I think it was a wonderful thing to set up initially, but I just don't think the need is there at this point. I do know that we're consolidating COVID-19 clinics in my area, and isn't that great news that there hasn't been the need that we had expected? Several large clinics have been closed in order to serve specifically COVID-19 patients, and I'm happy to see that those clinics are being opened back up to serve the greater community once again. At the end of the day, I'm glad that I was able to work in the COVID-19 clinic. I learned a lot about donning and doffing PPE and interacting with COVID-19 patients. Thanks again for joining me.